So, what grabbed you?
Well, a lot. It was a very, very rich set of presentations, and thanks to all the contributors for making some excellent points, and indeed for bridging some of these divides. I mean, all of us who work in areas of development policy are aware that we are to some degree in silos, and we work on our own things, but realize that actually for more effective delivery, we really have to work much more closely with other institutions, other agencies, and indeed on the ground. One of the things that we see is a tremendous disconnect between various service providers, between ministries who do one thing with one hand and another ministry does something with another. So I think that the conception of this meeting today is absolutely spot on. And you can hear from the various panelists just how by focusing on some of these issues, we've already started to see some cross currents in the papers or presentations that were given. I think starting with Una's, a couple of points. I mean, I think we all are so aware that the really serious problems that remain on to tackle, in terms of tackling maternal mortality rates are to do with a combination of aggravating factors within poor communities, problems of distance, problems of infrastructural capacity, problems of poor training, all of which add to the problems that we already know prevent poor women from accessing proper services. And I think those points were made very well. I mean, we get situations where health expenditure might go up, but actually the effectiveness of delivery, the forms of institutional arrangement, and indeed program design actually fail women at those levels. That, you can see from the statistics you might be getting uptakes, but actually what about the quality of what's being delivered? How effective is it really being? I mean, we can look at numbers of people attending clinics, we can look at numbers of training programs, but actually what's happening on the ground to those women? And the research that I've been involved in very poor communities in the Andes recently, but also in Mexico, I'm a Latin American specialist with a broader set of interests, show that, so many problems come down to things that could be very easily remedied. It's the kind of what I lots of people call the last mile problem. Why aren't, service providers giving proper training? Why haven't the lessons been learned about cultural sensitivity? In one program, we have a new program in Bolivia of the kind that Nicola was talking about. It's a CT, a cash transfer program, conditional cash transfer program, which is the Latin American model. It's a new one, relatively new, that's been set up by a very progressive government in Bolivia, committed to the MDG goals, lots of wonderful proclamations. When you get down to looking at what's happening in this program, for all the best will in the world, women are not using these services because they feel that they're being treated badly. The people training them have not been given any indication of cultural sensitivity. In fact, racism is a problem because the poorest people are very often black or indigenous or other. And so you're getting all kinds of reasons why these services are not being used by women, in addition to the kinds of problems that we know very well. And Una laid out in some of her graphs, distance and all the rest of it. And Leo touched on in terms of vouchers being perhaps able to overcome some of these problems. But I guess my sense in all of this is that there are questions underlying a lot of the problems that remain that require a gender analysis to try to understand the specific forms of vulnerability and risk that women in poor communities suffer from. And very often program design and ministries are simply not looking behind the statistics to see how they can improve some of these questions. And of course, there's some of the problems of unintended consequences. You set up a terrific system that's meant to, solve problems, and you find that it's creating more problems. And of course, again, the problem of incentivizing unsafe motherhood by making it possible for women to claim more money, as in some cash transfer systems, but not adequately providing the means by which women might be able to space their births properly, be properly trained or given proper sort of clinical knowledge of what's going on in terms of safe motherhood, family planning, and all the rest of it. These are solvable problems, but they very often don't get factored in, unfortunately. And, you know, to Una's question, how do you sort of or also Nicholas, how do you de-incentivize women from having lots of births together and so forth? Well, again, that's not a simple problem, because it also depends upon, for example, women's access to employment, being able to think of herself as more than a mother, again, as Una said, being able to engage in the in income generating activities and so forth. And if programs actually de-incentivize that, then we are left very often with short-term programs that fizzle out after a few years for lack of funding, and women lack any sort of other means of support. You know, the transfer comes to an end, they've got lots of children and so forth. We find lots of problems with short-termism in this area. So again, you know, we've learned lots of lessons here, and I think the sad fact is that they're very often not being properly addressed, although happily there are some good stories, and Nicola laid out some. I'm not so sure about vouchers, Leo, but I think you made a very strong case for what they do deliver. I think the big question you raise is one we don't know the answer to. I am skeptical about privatizing health for the reasons that the ultimate motive is a profit motive. And, you know, we haven't really talked about the kind of the impact more broadly, and we don't know yet on you know, other forms of provision by the state, or other forms of associational provision, which are very novel. But there are always, we come back to the question, why is the state so inefficient? Why, you know, do people prefer to go to private? Why can't we improve forms of delivery that are out there? And that question, again, is a complicated one, and some of us know some of the reasons in some context, but it seems to me that the rush to privatization would be, for me at least, a considerable worry if you think about the broader impact on services. How am I doing for time?
You need to stop.
I need to stop. One final point, if I may.
Of course, please.
Can we also sort of think about involving women more in program design, and also beyond, you know, taking an integrated approach to delivery, think about women's associations, women's organizations, women's ministries, women's machineries, because if we're going to try and understand the vulnerabilities women are subject to, we need to talk to them too.